In this video, we discuss ACTH-independent macronodular adrenal hyperplasia. This is a very rare cause of Cushing's syndrome. There is a bimodal age distribution, with the first peak in newborns, which is associated with McCune-Albright syndrome, and the second peak in adults above 40 years. Clinical manifestations of this syndrome tend to be milder than usual in Cushing's syndrome. The pathophysiology remains unclear. You can find a massive bilateral adrenal enlargement, nodularity, and distortion of adrenal gland contour. Nodules vary in size from 1 to 5.5 centimeters. On CT, nodules are low attenuation in keeping with their high lipid content. When considering CT or MRI coronal imaging, it demonstrates the best view of the craniocaudal extent of the adrenal glands. It frequently extends from the diaphragm to below the renal hilar. On MRI, nodules are hypointense relative to the liver on T1 weighted images and hyperintense to the liver on T2 weighted images. On chemical shift imaging, nodules due to their high lipid content lose SI on out-of-phase images. In ACTH-dependent Cushing's syndrome, nodules are isointense to the liver on T2 images. While in primary pigmented nodular adrenocortical disease, nodules are hypointense on both T1 and T2 weighted images.
If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.